way to this part right here. And by the way, these things right here, these RC means rotator cuff. That's the four muscles of the rotator cuff. And go down to the arm, and then the anterior forearm, posterior forearm. So these are the muscles that I'm going to ask you about, okay, or that I can ask you, okay? The ones that I was talking about yesterday, or that I halted on at the hand, I've considered about adding muscles, especially in the hand. Muscles that, I'm trying to look for muscles that easily do opposition and reposition, and the problem is there's so many muscles involved. So that's why I included that slide, but that slide really isn't going to be a lot. In terms of the number of questions here, again, you're talking about maybe one or two questions on the hand, or the forearm and the posterior and anterior forearm, because there's so many questions I can ask about everything else. Okay, so in addition to the lecture notes here, the bio 3, the muscles here. You see this, and I don't even remember making this.
Is that what the Sindaver used to look like?
This was the old Sindaver, yes. So
It's kind of terrifying.
this is the old Sindaver, and I think these are diagrams that I took from the book, from the old book. Okay, so if you look at this here, I got it labeled. Then I put these diagrams in here again. I think these are from the diagrams. Superficial muscles, deeper muscles. The blue is deepest still, and the green is the deepest. With the answers. Anyone interested in this diagram right here?
Oh yeah.
Kind of have to.
Everybody.
Why?
I don't know why.
Posterior muscles.
Anyone interested in this diagram?
Yeah. Yeah.
I'm going to tomorrow morning, or actually, I have to, not tomorrow morning, this afternoon, I have to go to Rhinai, and I have to go to a meeting, and my biggest objective is not to fall asleep, just like this. Like here.
What's the meeting on? Is it boring?
Uniform.
It's a boring meeting. It's going to be how to be happy with your work.
That's not making
How to
me
what?
happy.
How to
though.
what?
That's impossible.
How to be happy and content with your work.
Oh.
Huh.
It's like,
Boring.
That's the kind of professional development you do?
I mean, if you're not already content with your work, then
This
maybe
year
that's
it
the
is.
job for
Oh,
it changes periodically, and so anyway,
That
that's
sounds
that.
so boring.
Continuing on, again, look at the muscles that are on the list. Look at the muscles that are here. Those are the muscles that are that can be on there. So if you look at this one right here, the serratus posterior, that's not on the list. I'm almost positive. Again, check that again. Here are all the answers. We talked about the rector spinae muscles. Here are the rector spinae muscles. They're essentially anything that's parallel to the length of the body on the posterior surface, parallel to the spinous processes of the vertebrae. That's an erector spinae muscle. And then you got other diagrams too. Okay. Another thing I want to bring up is that, again, I want to accept that if you guys don't want to take the quiz, I offered this quiz up for you, that's fine. There's several of you that haven't taken the quiz. And if you don't want to take the quiz, then you get a 0. There's no questions, right? And then what am I going to do? Well, at the end of the semester, I drop your lowest quiz grade. Now, let's say you have a crummy quiz grade, and then you have a 0. Guess what? You get the 0 dropped, and you get the crummy quiz grade included into your average. There's 7 quizzes that are going to be incorporated into your, as an average, and that 7 quizzes will be equal to 1 exam. Okay, so your final grade will be calculated out of 6 exams, 5 regular exams, and 1 combination quiz. Okay? So, if you don't want to take the quiz, that's up to you. That's fine. I think it's not a good choice, but I'm fully fine with you guys making those choices. Another thing, and this is scary. Tomorrow's Halloween, right? Who's gonna get dressed up as Halloween?
I'm wearing a shirt
Yeah.
that says boo.
I'm
Yeah, so
being the
it's
red.
the 30th right now.
I'll be a minion.
Let yourself
But
Taylor Swift.
you want to know what's really scary? So I was
Failing.
walking with my wife yesterday in our neighborhood. We were walking our dog, and we walked by 2 houses that were really scary. And I'm not joking here.
Oh, you were like shaking in your boots, huh?
Quaking.
Wait. One house has like a 12-foot tall skeleton, and the skeleton's like this, and in the hands of the skeleton is Trump 2024 and Take America Back.
That's scary.
And I was
That's really
like,
scary.
I said to my wife, Steph, I can't believe this. So then we walk up another street,
Why are they putting politics into Halloween? No, yeah, what the hell's going on? What's people's problem?
then another street, across a big ass banner across. It's like as big as this damn whiteboard. Trump 2024, Take America Back. I was like,
Bring back, make America
I said to my wife, I said, what if we live in? What? I want to move.
Get out of there.
I want to move.
Make America great again.
Well, you do live in Cumberland.
Well,
I love Kamala.
So-
I love
Oh my god,
Kamala.
when I went
Love
to,
Kamala.
there's one of the houses near my
Are you
aunt's
with
house.
Kamala?
When
I can't vote at all.
I'll vote for Kamala. Don't worry.
And this was there last time I went.
I'm 16.
6 Trump signs in a row.
So if you guys are at all worried about the election, if you're half as worried as I am, please vote. Please vote if you can. And if any of you know anyone of color, female, anyone who has been an immigrant in the last couple of generations, right? I don't know, that sort of includes everyone in this
I already
room.
told my mom.
Except for me, my grandfather came here, so that's 2 generations, right? But,
I already told my mom I'm framing my eyebrows.
oh, and by the way, you want to know why most immigrants weren't violating the law when they came? My grandfather came in the early 1900s. Want to know why he didn't violate any rules?
Because there weren't any.
There were no laws back then. So how do you violate a law if there's no laws, right? So, all right, my grandparents came, or my ancestors came, and they didn't violate any laws. What?
There was no laws to violate, bro.
That's right. So anyway, forget about it. So I want to transition away from this quickly. I'm scared shitless right now, to be honest with you. I really don't want 2016 again. I'm like trying to,
Wait.
I don't,
Wait, it was 2016?
Trump. That's when he was elected.
Trump.
Really?
Trump got elected in 2000.
Only 2016?
2016 to 2020.
I was 8 then.
Yeah.
That was his term, 2016 to 2020.
Last year. Why can't Obama just serve another 4 years?
I only remember last year.
I wish he
He
could.
served 4 years.
I really wish he could.
Biden's not gonna make it 4 more years. Biden's
So
not making
Trump was president from 2016 to 2020,
it.
and or 2017.
Yeah. He's practically in the
All right,
grapevine.
so that's scary. Please tell your anyone that you know that's old that can vote. Please tell them to vote. Please, please, please. By the way, I voted yesterday. Woo! And I did
Where's your
vote for
I
you.
voted sticker?
I'm gonna frame mine if I get one.
I told him to vote, so.
All right. So today, what we're going to do, let's transition back to.
Bless
you.
Thank you. I don't know. Something in this classroom makes me sneeze.
There's so much stuff. There's so many good cells. So many good cells.
The government told me to keep that a secret. I was like, your bill was your secret.
So forget about people of color. How about women? I don't. How about anyone under 20? Anyone under reproductive age? I don't understand.
Exactly.
But I gotta stop. All right, I'm sorry.
No,
No, because I don't wanna be political, but I don't know.
Dr. Clancy for president, 2024.
We finished pectoral. Okay, we finished
I
pectoral.
mean, you'd be better than.
That's crazy.
All right. So we're gonna talk about 2 things today. First is the pelvic and leg muscles. Again, now a lot of these muscles are very big. They have large origins and large insertions. Some of them have very, very broad insertions. Remember the terminology that we use on the skeletal system. If it comes into play, for instance, the linea alba, and the linea aspera. What's the difference? What's the linea alba and linea aspera?
The alba is like the skull and the aspera is the abdomen.
The aspera is the abdomen, that's right. But remember those terms, right? So medial epicondyle and the femur, there's the greater trochanter, the lesser trochanter, all those terms come into play, potentially, right? Depending on the question. So that's the first thing we're gonna do. Then we're gonna take a break, and then I'm gonna remind you of everything that we've done, and we'll have a little bit of a review. If you guys have questions about it, the second half of the class, this last couple of days of lecture, there's not a lot for me to review because it's just the muscles, right? And that's work for you guys. Right? So let's get started here. Pelvic and leg muscles, both anterior and posterior. So we're going to scroll through the first few pages of this, first few slides of this, because this is the same chapter. It's sort of the end of the chapter here. Anterior versus posterior view, and this is what we're talking about tomorrow, or tomorrow on Friday. So if you start looking at the muscles of the lower limb, you can move the femur, and you can move it in a couple of different ways. Most of the time, if the muscle is moving the femur, it has to insert on the femur. If it inserts onto the femur, and it's moving the femur, then it's got to originate somewhere else. And generally speaking, it originates superior, proximal, medial, and it's going to be immobile. Those are the rules of origin or insertion and action. So, for instance, the movements of the femur, then you're talking about the vertebrae and the os coxae. And by the way, there's a whole bunch of muscles that we're skipping there, right? And as you get deeper and deeper into the muscles, they can there's a bunch of little muscles. Tibial and fibular muscles, then the origin, we're gonna discover the insertion of the tibia here. There's one, the tibial tuberosity. There's an example of something that we talked about last unit. The tibial tuberosity is going to come into play greatly today. And then we're only worried about moving the entire foot. We're not worried necessarily about moving the phalanges of the foot. So that if we're moving the foot, we're doing dorsiflexion, plantar flexion, inversion, and eversion. Those are going to be inserting onto the tarsals and mostly metatarsals, to a lesser extent the phalanges, because again, we're not worried as movements of the phalanges as much. So that's what we're headed. If you're talking about muscles of the anterior thigh, or the anterior hip rather, we're talking about muscles that will, there's two muscles in particular called the iliacus and the psoas major. They are also in the book called the iliopsoas. Now these are deep. These are not something that I asked in the practical last week nor this week. There's posterolateral muscles. Notice that word I might not have used that word before. Posterior and lateral. Now it's combined to a new word. That posterolateral includes gluteal muscles, both the medius and the maximus and the tensor fasciae latae. And then there's some muscles that are thigh rotators. So the muscles can do, once again, they can do multiple things depending on the size. Gluteus maximus is one example of one that can do multiple things. Here's a list of some of the muscles, some of which you should be familiar with. So for instance, the two list of the muscles there that are flexors. So there's flexors there, extensors, and now these are muscles of the hip. They're extensions of the hip. And then there's abduction and adduction, just generally speaking here. Medial rotation, lateral rotation. So if you look at the last one right here, gluteus maximus right here. Now can you rotate your hip like you can rotate your humerus? No. Probably not, right? Why not? Well, the physical structure of the hip doesn't allow that. But there is modest lateral rotation. There is modest medial rotation of the hip. Those are the gluteus maximus. I mentioned a bunch of muscles that are not relevant here, and if you look at all these grayed out ones, those are not relevant, but the ones at the bottom here in the lower right-hand corner are. Make sure that when you're looking at these diagrams, you recognize which side is deep and which is superficial. Obvious, if you look in the upper left-hand corner here, the right-hand side is superficial, the left-hand side is deep, and generally speaking, if you can see, if you look at the right-hand side of this anterior hip and thigh, or posterior hip and thigh, sorry, you can see both the gluteus maximus and the gluteus medius. You can see those muscles posteriorly, and you can see them laterally as well. In addition to a lateral view, there comes into the play the tensor fasciae latae. Now, when you're talking about the tensor fasciae latae, I want to draw the distinction here. If you look at where my pointer is, that's where technically the muscle is. Right? Now, the muscle is relatively small and it's contractile, right? And what is its insertion? Well, its insertion is really going to be 2 or 3 things, but they all go to the same spot. The first insertion will be this white stuff, which is called the IT band or the IT tract. Here it's called the IT tract or the iliotibial tract. The iliotibial tract will then come down here and it splays out and it goes in a couple of different directions. One direction is you might see it on the patella, and then another direction you'll see it on the patellar ligament, and then finally on the tibial tuberosity. Now, that's all, that description that I just made is all a single chain of events here. So if you pull on the tensor fasciae latae superior, way up there, right, it's going to pull on this thing, it's going to pull here, it's going to pull here, and it's going to pull there. So how do you control it? Well, with other muscles. The tensor fasciae latae is definitely a lateral muscle that's a muscle that's both lateral and medial. If you look down here in the lower left-hand corner, both the gluteus maximus and the medius are cut back, and deep to that are the gluteus minimus. Again, I don't think you need to know that. I don't remember now. And then we're going to talk about these muscles right here, this lower right-hand corner diagram. These are the iliopsoas muscles. The iliopsoas or the psoas group include, there's a couple of muscles that originate up here on either the os coxae or the vertebrae, and then other muscles that originate in the inferior portion of the os coxae. All of these muscles will insert on the femur or down again on the tibial tuberosity, the medial border of the tibia or the medial epicondyle. So let's start with these. This is the iliacus, and the iliacus is part of this psoas major or this psoas group. The iliacus, the origin is the ilium or the iliac fossa. It's the same thing, right? You should recognize both of those. The insertion is the lesser trochanter of the femur, and again, now we're going to say, it says here femur flexion, but let's change that really, because what we're going to say is this is an adductor. Right? Wait a minute, back up. The iliacus and the psoas major work together. The psoas major, there's also a psoas minor that's not included in this group. The psoas major, where does it originate? In lumbar vertebrae and on the transverse processes, and then also the body of the lumbar vertebrae. So how would I mix you up with that? I could say sacral vertebrae, thoracic vertebrae, cervical vertebrae, things like that. Again, the lesser trochanter of the femur, and you see this says adduction. So we're going to say both the iliacus and the psoas major are both adductors. Okay? And they go in with another group. And so here's what this picture is. And by the way, this is the psoas major and this is the psoas minor. The psoas minor is not part of this whole category. If you look inferior now on this portion of the diagram, if you look at these red words here, some of them are familiar here. The gracilis on the left-hand side, that's medial. The sartorius is medial or lateral, depending on where you are. But forget about those, then what we're gonna be doing is looking at these muscles right here. It looks like there's 1, 2, 3, 4, but in reality, there's just 3 muscles that we need to know. They all are starting with the same name. They're all adductors. So now we have 2 adductors that are superior and insert on the lesser trochanter, and then 3 adductors that are inferior, insert on the medial border of the femur, amongst other places. Those adductors, this adductor group right here includes the magnus, longus, and brevis. The magnus is the biggest one, the longus is the longest one, and the brevis is the shortest one. The origin, it tends to be the pubis. I've seen some people, some places write the inferior ramus of the pubis, the pubic symphysis, but, so, anyway, that's that, right? The adductor magnus, again, the pubis bone. I mentioned the linea aspera on the femur. The linea aspera, it becomes important. The linea aspera is this very long line that is on the diaphysis of the femur, and it's posterior. So now, we're absolutely gonna say that these adductors, if you look at the action over here, they adduct, adduct, adduct. But also, if you, under the right conditions here, you can move your hip, you can laterally rotate your thigh as well. And when you laterally rotate your thigh, those adductors will come into play. Why is that? Because the linea aspera is on the posterior surface of the diaphysis. So it will allow the femur to rotate slightly.
Interesting.
But for right now, right, once again, we're just calling them adductors. Femur adductors. Another example of the muscle that's familiar with you is the gracilis. The gracilis then is going to originate on the pubic symphysis and the medial border of the tibia, the patellar tendon, the medial epicondyle or the medial epicondyle of the tibia, and it's going to be adducting the thigh as well. And if you look here, it says adducting the thigh and then also flexing the knee. That should be extending the knee, flexing the tibia. It shouldn't be flexing the knee. I try to change the stuff, so I'm still working on this stuff. I want to be more specific here. Flexing the knee doesn't make sense to me. I want to say flexing the tibia. Right? But the reason why I'm bringing up the gracilis here is that that's also a familiar muscle that you've already talked about. We've talked about the iliacus and the ocellus major. So I mentioned a little while ago that Arlen had said that it's confusing when you go online and you find all the origins, assertions, and actions of these muscles here. And I told her, don't do that, just stay here. So if you look at the origin here, it says of the ocellus major. I told you that it's the lumbar vertebrae, the transverse processes, which is true, of the lumbar vertebrae, and the body of the lumbar vertebrae. And here it says the T12. I'm not going to say T12. I'm not going to ask you about thoracic vertebrae. Right? So if I'm trying to confuse you, I'm going to be saying the T1, 2, 3, or the top thoracic vertebrae. If you look at all of these muscles that are grayed, and again, I'm including them because periodically I look into them. I look into adding muscles as I go. One in particular is the piriforms, it's right there, but we're not adding them this semester. All of these muscles right here are the posterior lateral gluteal group, including one that you know already, the tensor fasciolatae, the maximus and the medius. Both the maximus and medius have a lot of origins and relatively few insertions. Now the maximus has more insertions because it has a combination of a surface insertion on the femur. I don't think that we need to know the gluteal tuberosity in the skeletal system. I don't remember now. But another insertion of the maximus is the IT band or the IT tract. So you can have 2 tracts here. The gluteus medius is significantly smaller, and it's got the greater trochanter of the femur as its insertion. I don't think that I put on the minimus here. what are some of the movements here? We're depending on what you're doing. If you're standing with your legs and the legs are not moving, and you move your hips forward, or that could be, or I'm sorry, posteriorly, right? That could be the action of the gluteus maximus. It could be action of other muscles as well. The gluteus medius. That's what this means right here. Extending the hip. But what we're going to be doing is talking about moving the femur, right? And where is it going to be moving the femur? So this is femur flexion. This is femur flexion. This is femur extension here. So that what is femur extension is going to be pushing the femur inferiorly and posteriorly, and that's the result of the gluteal muscles. So I'm basically trying to narrow down some of these things and tell you what the major focus is. If you look at the origin, and by the way, these OIA here, those are origin, insertion, and action here. The origins, there's a bunch of origins. They're all over the posterior os coxae, sacrum, and coccyx. And they merge onto a single or a pair of insertions here. And we're going to say it's a femur extensor. I'm not as worried about lateral rotation. That's not nearly as significant. So that's the maximus. Here's the tensor fascial latag. This is the contractile part of it, the red part right here. And it inserts down there on the IT band. So here in this slide, it says it inserts on the tibial tuberosity, but how does it get there? It gets there through via the IT band. The same thing is true with the gluteus maximus here. The gluteus maximus, which is on what I'm pointing to here, merges onto the IT band as well, and so then that by definition will also be pulling on the tibial tuberosity. When you look at the posterior thigh, and I'm reminded of a student when I was teaching but it was human anatomy, and this student is named Sheba. She was a former student of mine. She's now a nurse, and she's a grown-ass woman, so I actually have her phone number now, so she came to visit me a couple years ago, and it was awesome when she told me all the stuff to do. One of the things she said to me was that I used to think your class was scary, and then she went to URI, and then she got her nursing degree from Rick. She goes, and then as things progressed, I thought those classes were scary. But you know what? She's swearing now. You know what's fucking scary? I was like, what? She goes, being the only nurse on the floor, walking into your patient's room, and having tubes coming undone, and you look around, there's no one around, and you don't know what the hell's going on, because you don't know this patient, and you gotta figure out how to save their life. So what do? Go get a book? Go get your professor? No, you gotta figure it out right then and there. That is really scary. And she said, so tell your students that your class might be scary, but it's gonna get a lot worse. But anyway, back to her. I was telling her that I was mixing up the lateral surface and the medial surface of the thigh, and so I was telling her, oh, these are these muscles, and she said, no, Dr. Pence, I think you're wrong. I think it's these muscles. And I looked, and I went, hold on a second. And I turned around and went, holy crap. And I high-fived her, and she goes, what? And I said, you're right. That's awesome. And so she had the courage, she had the knowledge enough to say to me, Dr. Clancy, I think you're mixed up. And I tell you guys all the time, I get things wrong. And I'm not doing it on purpose, I just mess up. So here's what I did. I didn't look down here at the bottom of the knee. If you're looking at the bottom of the knee, or at the posterior view of the knee, and you say, what side of the body is this from, first of all?
Right side.
The right thigh is right there. If you don't know that, right, it definitely should be the right thigh. So if this is the right thigh, and it is, then this is medial, and this is lateral. So now, you come down here, and they separate. There's muscles that are lateral, and there's muscles that are medial. Now, some of these muscles we already know. This muscle right here is the gracilis. These muscles up here are the adductor muscles. Depending on where we are, they're the adductor magnus, brevis, longus. If you come down here, these muscles right here there's one muscle right there, and then there's this muscle right here. You see how it's divided into two. But this muscle right here is medial, so that's a semimembranosus. Okay, so the semimembranosus is medial, and adjacent to the gracilis. So there's the gracilis, semimembranosus, and then the next one is the semitendinosus. And this is all on the medial portion of the knee. And that's what I screwed up on. Look on the other side, the lateral portion of the knee. You have two heads here. There's a long and a short head of the same muscle here. This is the short head. The short head is lateral and it's part of the biceps femoris. And the medial one is the long head of the biceps femoris. The short head of the biceps femoris attaches on the posterior portion of the femur. It inserts. Where does it insert? Right down here on the lateral condyle of the tibia now. These will insert on the medial condyle of the tibia, or depending on how far anterior we go, we can get to the tibial tuberosity. So depending on how far we go there. So there are these muscles right there. And so there's this group right here. Those are going to be flexors of the tibia or flexors of the fibula. What's the difference here? Procedurally, physically, nothing, but what's the difference is it tells you what the insertion is. If you're a flexor of the fibula, then you're inserting on the fibula. If you're a flexor of the knee, of the tibia, then you're inserting on the tibia. And that's why I'm making that distinction here. At the end of the day, they're both going to be flexing the leg of the tibia and the fibula because you can't really separate that. Here's a picture of it unlabeled if you need to. Again, now this is what you're going to see, right? So you need to have some points of origin or points of sort of understanding where you are. Obviously, the gluteus maximus and the hip is one big area. IT band's another big area, right? And then the in portion of the knee, posterior view of the knee. Once again, look at the picture itself and make sure that you know what you're looking at. Because if you think you're looking at the left side and you're looking at the right side, if you think you're looking at superficial muscles and you're looking at deep, right, you're going to get mixed up. This muscle right here where my pointer is the gluteus maximus, and that part is cut. Deep to that and lateral. So the gluteus medius is also cut, but the gluteus medius, if you look up here, the insertion, or I'm sorry, the origin is much smaller than the origin of the gluteus maximus. The gluteus maximus has origins on the iliac crest all the way down to the coccyx. The gluteus medius generally is just the iliac crest. So where my pointer is where the just for the origin of the gluteus medius. Anyone want me to add these muscles right here? Any of these, all these muscles right here? These are a whole bunch of muscles, and I always think about doing it. Generally speaking here, what I'm not going to do is I wouldn't show you this diagram right here and ask you to distinguish between these muscles here, with one caveat, in other words, one exception. If I show you this picture right here, and I ask you, what muscle could this be? So for instance, what muscle, this is the biceps femoris. What muscle could this be? Or what muscle could this not be? This muscle cannot be the biceps, the short head of the biceps femoris. This muscle cannot be the gluteus maximus. This muscle cannot be a whole bunch of muscles right here. How do you know that? Well, the long head of the biceps femoris, the long head here, reaches all the way up to the ischium. The short head originates on the linea aspera of the femur. And so that's how you know that. And we're not anywhere close to the femur right here. Okay? So that's what I would ask questions about. Or how I might ask a question. So there's extension of the tibia, generally at the tibial tuberosity, flexion of the femur. Generally speaking, the tibial tuberosity, the patellar tendon, what's the difference between the patellar tendon and the patellar ligament? The patellar ligament is superior and proximal to the patella. The patellar tendon is inferior and distal to the patella. And they're all going to be doing the same thing. things, more or less. Muscles that are on the anterior portion of the leg are doing one thing, muscles on the posterior portion of the leg are doing something different. So, and that's what this means here, the anterior compartment versus the posterior compartment, the extension or flexion of the legs happens differently. So on the left-hand side, we have a posterior view of the muscles. On the right-hand side, we have an anterior view of the thigh. This is both the right thigh, and this is both superficial too. So this is what you're going to be seeing tomorrow. And again, now I'm going to ask you what's this muscle versus that muscle? What's this muscle versus that muscle? The one thing I will say is that be careful about the semimembranosus. Right? The semimembranosus is where I'm pointing to right here. If you notice here, the semimembranosus has two parts to it. Right? The semimembranosus, as it comes down and it inserts on the medial portions of the tibia, right here, it comes down. It is wide, and it's a bigger muscle than the semitendinosus. The semitendinosus is relatively narrow, and they originate in the same spot. Right? They insert in the same spot. The difference is that the semimembranosus, again, that's medial. So this part right here where my pointer is, I'm going to try to always point to the medial portion of it. And then what we're talking about here, we're going to be adjacent, I'll be adjacent to the gracilis right here. And by the way, this is the sartorius at that point. So again, these muscles, right? So some of the, I'm trying to distinguish anterior versus posterior muscles, but sometimes other muscles will bleed into one view or another. Anterior view of the thigh, the quadricep muscles, right? All right, so of these quadricep muscles, the deepest muscle is the vastus intermedius, and it's the shortest muscle. The origin is going to be the anterior surface of the femur, and the insertion is the same, right? The insertion is the patella, the tibial tuberosity, the patellar ligament, the patellar tendon, right? All of those things, it's going to extend the tibia, and it's the deepest muscle. In both cases here, this muscle right here, this diagram, the rectus femoris is removed. Now, I would not show you this picture right here on the right-hand side, because I would show you, if I'm asking about the vastus intermedius, I would show you one view of the thigh unaltered and another view of the thigh, the other thigh altered, so that you have some point of reference. Here's a list of tibial extensors, part of the quadriceps femoris here, but we don't have quad muscles. We have the rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. I should write flexors of the tibia and fibula. These are, I think I did put the popliteus on there. The biceps femoris, the sartorius, semitendinosus, semimembranosus, those are the big ones. The popliteus is a very short muscle. It's a, wait a minute. I'm still thinking about the old book. In terms of the muscles that the origin of these quadriceps muscles, this is where they differ. The origin of the quadriceps muscles, so the iliac spine, right? So the anterior, inferior iliac spine, so that's both anterior and lateral here. The vastus lateralis, the greater trochanter. I already talked about the vastus intermedius, and then the vastus medialis is on the posterior portion of the femur, so that can actually be a rotator, but we're gonna ignore that. So those four here, all of them have the same insertion. So what is really going to be easy to ask about is which one is the longest, which one has the shortest, the most distal origin, which one has the most proximal origin, which one has the most posterior origin, things like that. The biceps femoris, we've already talked about identifying and distinguishing between the biceps femoris, the semitendinosus, the semimembranosus. The biceps femoris comes in the long head and the short head. The long head is on the portion of the femur, the short head on the femur, and the posterior femur, not even up to the linea aspera. And the long head is on the ischial tuberosity. So the long head isn't even on the femur. Right? It originates on the femur. Where does it insert? On the head of the fibula. So again, this is going to be a fibula flexor. These will be tibial extensors. The poplitis is a muscle that is lateral here, and it's going to help medially rotate. It's going to be on the lateral condyle of the femur and the posterior tibia. So in the lateral condyle of the femur, if that's on the right-hand side, it's going, and it goes on the medial posterior tibia, and it's going to help be a flexor. It's basically a diagonal muscle. We've already talked about, the sartorius is the strap muscle, right? Now the sartorius is going to be starting superior and lateral, and it's going to come down and medially up, insert on the tibial tuberosity again, and it's going to be a leg flexor, then medial rotator of the leg as well. And then the tendinosus and the membranosus. If you look at the difference between them, the tendinosus and membranosus, they're parallel. The membranosus is bigger. They both originate in the ischial tuberosity. They both are going to be flexing the knee, and in particular, they're going to be on the flexing the tibia. Where are they located here? On the medial condyle of the tibia. And generally, I think that the semitendinosus is also the medial condyle of the tibia as well. So they're going to be flexing, instead of flexing the knee, it's flexing the tibia. So I want to, again, draw the distinction between the biceps femoris flexing the fibula and the semitendinosus and semimembranosus flexing the tibia. At the end of the day, the movement is the same, but I want to draw that distinction so that it helps you remember the insertions. So let's talk about the distal leg here, and movements associated with that. So what are we talking about? Inversion and eversion, dorsiflexion, plantar flexion, right there. So there's an anterior, generally speaking, there's a small anterior compartment. There's a very large posterior compartment on the thigh, and that posterior compartment sort of bleeds into the lateral area of the thigh. And here is a picture of that. Now, if you look at, this is the a picture of this is the left leg now. This is the tibia, here's the fibula, here's the anterior portion of the thigh, here is, I said, the big posterior portion of the thigh, and a little bit of the lateral portion of the thigh. So again, now this is a transverse section of thigh. In terms of the muscles themselves, this muscle right here is going to be the gastrocnemius. And then the muscle that's deep to that is going to be the soleus, right here. The muscles that are anterior to it are going to be the tibialis anterior. That's something familiar to you. On the left-hand side, we have the gastrocnemius. The gastrocnemius has two heads. There's a medial and lateral head. The origins are different. The origins are both on the femur. The origins and the actions are the same. Right? Why are the actions the same? Well, the actions include that the insertion is the same on the calcaneus or the calcaneal tendon, and what does it do here? It's going to be plantar flexion. So it's going to elevate the calcaneus, and in the process of elevating the calcaneus, you're depressing the metatarsals, and in the process of depressing the metatarsals, that's that movement that I just talked about. So now, if you look at this diagram right here, this diagram on the left-hand side is superficial. This diagram in sort of the left-hand side, in just one step in here, is deep. Now, this muscle right here is called the soleus, and so it runs in concert with the gastrocnemius. The soleus is an agonist with the, it's in the mover, the main mover group as the gastrocnemius. The gastrocnemius is the prime mover of this group. The soleus has the same insertion and the same action. The soleus is shorter than the gastrocnemius. Soleus, the origin is going to be on the tibia and the fibula, the lateral portion of the tibia and the fibula. Think that there's I don't remember now, the tibialis posterior. There's a tibialis posterior and as well as a tibialis anterior. This one right here is a deeper muscle, right? And where's that? More pictures right here. If you look at this middle view right here, we have a major picture of the medial head of the gastrocnemius. And then you look a little bit distally there, there's a little bit of the soleus. Once again, the soleus is basically helping with the gastrocnemius along. It's a lot like the way the biceps brachii is helped by the brachialis. So the soleus and the brachialis are very, very similar. There's dorsiflexors and plantar flexors here, so we don't have a lot of dorsiflexors on this list here. There should be the dorsiflexor should be the tibialis anterior. I'm not sure why that's not on here. Oh, it's right here. Duh. Sorry about that. So the tibialis anterior. Where does the tibialis anterior originate? On the tibia itself and the interosseous membrane. So the lateral tibia and the interosseous membrane. Right? And then look here on the cuneiform bones and the metatarsals, and then that's going to be dorsiflexion. I'm not as worried about inversion and eversion, right, because those are not nearly as much major movements here. Gastrocnemius and the soleus here, plantar flexion, we've already talked about them. The soleus is shorter than the gastrocnemius, so the soleus is found, they originate on the tibia and the fibula. The gastrocnemius does not originate on the tibia and the fibula, it originates on the condyles of the femur. And then there's the fibularis brevis and fibularis longus. I don't even know if I have any questions on those. And I don't remember talking about, I'm trying to remember if I've written questions about these. But if you look at these toes, these flexor digitorum, so the term digitorum, what is it going to be moving? It's going to be moving the phalanges of the foot. So it's going to be moving either superior or inferiorly. And so there is going to be flexors or extensors. The way that they work is that they pull on ligaments that then pull on the toes themselves, the phalanges themselves. So the muscles themselves aren't on the toes, just like you don't have big muscles in your fingers. You have small muscles in your fingers, but most of the muscles that move your hand are associated with your palm of your hand or your forearm. And don't think that we talk about this. Yeah, I think I stopped here because these two slides are grayed out, so I think I stopped here. All right, so any questions? Who's shell-shocked right now?
Shell-shocked?
Yes. Who is? Oh my God, how am I going to remember this all? Right. Now is the time to start studying. The way that you should start studying is to break these groups of muscles up into small categories and try to, hopefully, the lecture that I provided today and these last couple of days have helped you sort of group them into small groups. Those focus on similarities, and then that's how I would group them. And then what you can do is then focus on the differences. So, for instance, if you're looking at similarities here, so the muscles that we were just talking about, the semimembranosus, semitendinosus, the biceps femoris, all of those three muscles there will all be leg flexors, either tibial flexors or fibular flexors. What's the main difference here? Well, the biceps femoris has a short head that originates on the femur. The other three originate on the ischial. The other three one head and the semitendinosus and semimembranosus. So now we have the tibial flexor or the fibular flexor that's a group of 4 muscles, one muscle with 2 heads and then 2 different muscles. They have a different origin and different insertions, but the same action. So now what I'm hoping to describe for you is to try to figure out how to remember these things, because there's a lot, and I readily recognize that. There's a whole bunch of stuff, and once again, when you get into AMP2, you're gonna be saying, oh my God, I wish, like Blanca did earlier this semester, I wish I could hear Dr. Clancy talk for hours and hours, because it's a lot easier than doing it myself. So are there any questions from me? All right, so it is about 9:30. How about if we take a 15-minute break, 9:45, and then I'm going to get set up, and then we'll do a review.
I'm getting something from it.